Hello everyone, it's Matthew here again, raising awareness of unpaid carers, mental health, and this time poetry, as you can tell by this title. It's focusing on one of the most important aspects that I tend to focus on, creativity and poetry. And if you don't know, I've released quite a few books in the past, quite a few of them on my expression of poetry and what it's used for, in hence raising awareness, obviously, of caring for someone. So this particular video is trying to link several things. By the title, as you can see, we've got something on black carers or ethnic carers, and to be more exact, when you're caring for someone with mental ill health. The other thing it's linking to is poetry, forms of creation and expression, something I believe is and can be self-healing, a way to share knowledge and ideas, influencing others, storytelling. And the next thing, and do forgive me if you don't know what PCREF is, but it's another thing to link in regards to this particular video. And PCREF stands for Patient Care Race Equality Framework. But before I continue, if you like the content of my video or other past videos you might have had a look at off my YouTube channel, do feel free to give this video a like or subscribe to my video channel. So why am I mentioning black unpaid mental health carers, or ethnic, to be honest? Well, there's several reasons. From my lived experience as well, unpaid carers, especially black, Indian, Asian, they do support family members of loved ones, and this will be focused on those living with mental health. They have mental health needs. Carers of coming from that background often, they do this without pain. This goes to all unpaid mental health carers, to be honest. But just as a reminder of unpaid carers, yes, there's not much recognition. Support can be dwindling, resources are not always there, and it can unfortunately be inadequate support for those caring for someone. But navigating the health and social care system, especially mental health system, there are occurrences of systematic racism, stigma around mental health, and specifically for carers, emotional exhaustion while trying to hold their family together and communities together. However, what I think anyways, stories from carers are powerful and can often be unheard. So how does this link with poetry, with what I've mentioned before, those very three things, carers, poetry, and the new initiative, PCREF? Well, before we move on to the patient care race equality framework, I want to talk a bit about, how poetry, well, how what I think how poetry helps, and how it helps me. And this is me reading, a poem from my book, which I released around about 2023. So this was read out during Black History Month over in West Sussex Crawley Museum with support from West Sussex carers. And throughout those years, I felt poetry had offered me a way to express feelings that were hard to explain in other forms of language. Most of the poems in that book, as you can see here, the Poetry Book of Mental Health Caring, they were quite a lot of poems on grief, on anger, also on love, and resilience. And that is quite important because I'm going to recite a poem later that exactly links to resilience. What I mentioned before about the problems of navigating the mental health system and dealing with discrimination, stereotyping, and stigma, I do feel it's a way to reclaim a voice and reclaim that identity rather than being hidden, and being sort of felt as not valued, but being a cog in the wheel, which can all too often happen. as a carer. Linking that to black carers, minority, well, ethnic, global majority carers, it's a way of forming a cultural expression, a form of speaking truth without sort of needing permission or using professional words. And what I mean is, we're not born poets. We're just trying to express ourselves. We're just using poetry as a way to do this. For those who are from that ethnic background, I personally feel poetry becomes the following. It's a private space. It doesn't always have to be, actually, but a space for that emotional survival. Not only is the patient trying to survive, but also the family and carer. There's a cultural tradition in storytelling, as I mentioned before, but also used as a rhythm and protest. And from most of my videos, I often introduce myself as an activist, as a care activist. I do feel it's also a form of resistance against what can be uh, silence, in ingrained silence in the system, a dismissal of your role and identity. And also, black carers, minority carers, ethnic carers are hitting with a double whammy. Not only are they invisible in a caring role, but they can become more even invisible during ethnic struggles within mental health systems and even on beyond that. So this links to the third thing I'm mentioning, which is the patient carer and race equality framework, which is a framework that helps and aims to improve racial equity in mental health services by centering lived experience, that grassroots experience that can be brought in through not just words or feedback, but through creativity and poetry. And poetry can support that framework by allowing others, not just carers or patients as well, obviously. But the reason I mention carers is because that's my lived experience, and I can't really speak for those who live with mental health. Those are their stories. But for carers, I feel they can share their voices in their own words, and that's probably why I mentioned that is, I'm unable to share patient stories. It's their own words, and carers have their own words. With PCREF, though, a large chunk of it does focus on data, gathering data and promoting what is happening through evidence. But I'm seeing as a way to perhaps humanize that data with that lived reality, and that's again through poetry. Sometimes it can be very hard to challenge institutions at their level where they're using hard data, reams of jargon. It's all professionalized, which I guess it has to be. But if you want to center in on that lived experience, then it's a way to challenge where institutions can listen. I'm not saying they all want to, but it's the opportunity. They can listen, reflect, and maybe there's a chance to change. We're just adding something to it. And we're informing not just through feedback, but culturally, using responsible practice and through that policy. So the last bit, really, my call to action on this, and this is going to link up to a new book I'm working on for 2026. It's possibly going to be my eighth book. And I think this is one of the best ways I think to support ethnic unpaid carers, black mental health carers. PCREF actually asked to create safe spaces. I'm just going to link this up to poetic expression. As you can see from the picture here, we have those just creating poetry and writing things down, what comes to mind. Poetry can be included in training. Do consider this video, some ways of raising awareness and training. I often read out poetry through, sometimes, not always, through community engagement. I do hope that there's value to the emotional truth alongside that clinical evidence, that hard data. And it can also center carers as myself as experts in their own experience. And what I'm going to finish up now is just another example of what I mentioned before about resilience and the example of poems that I've done before. This was again taken from my book I released some years back. As a leaf, we grow resilient. Ever stronger, we grow as we develop. Keep moving and growing, flowing with the wind. You tumble down, but never give up. Keep climbing on raving up and up. Never stop and keep that resilience. Taken from my book, The Poetry Book of Mental Health Caring. I will revisit this subject. I'm going to start doing a bit of the designing for the new book. It won't be out until, as I said, probably around the summertime, 2026. I just hope we can get more promotion really on the importance of poetry and how it can raise that awareness and create a link, center that lived experience. Anyway, as I mentioned, if you like the content of this video, do give it a like, subscribe to my channel. Happy to share more videos later on. Thank you for watching.